On August 14, 2024, the World Health Organization, WHO, made an urgent announcement declaring MPOX a global public health emergency. Dr. Tedros, the Director General of WHO, stated that the rapid increase in MPOX cases could spread beyond Africa and that decisive action is needed to prevent a repeat of the 2022 global pandemic. In 2022, MPOX also led to a global public health emergency. Just as we were getting used to life without masks, a tragedy similar to, or even more severe than COVID-19 might be starting. MPOX, also known as monkeypox, is a viral disease that can be transmitted from animals to humans. It has been an endemic disease in Africa for a long time. It was first discovered in monkeys in a laboratory in 1958, and the first human case was reported in the Democratic Republic of Congo in 1970. Until the current outbreak, it was mainly found in rural and tropical rainforest areas of Central and West Africa. Despite its name, MPOX has little to do with monkeys. The virus was named because it was first discovered in monkeys, but it is believed that African rodents are the primary carriers. You might wonder why there's an emergency declaration when not many people are infected, similar to COVID-19. The maximum fatality rate of MPOX is estimated to be 5% for adults and nearly 10% for children, which is much higher than the 0.7% fatality rate of the COVID-19 Omicron variant. Although most of the fatalities are from regions with poor healthcare, it is still a highly lethal virus. MPOX, like smallpox, causes distinct skin rashes. Even after recovery, it can leave keloid scars on the skin. Additionally, those infected with MPOX have reported a burning sensation in their genital area. Considering these factors, the potential impact of a widespread outbreak is significant, leading to the declaration of a public health emergency. As the majority of MPOX cases were found among the LGBT community, homophobic sentiments have spread, worsening perceptions of these communities. While it is true that most confirmed cases have been among gay or bisexual men, MPOX is not a sexually transmitted infection. It is often mistaken for one because it spreads through very close contact, not casual contact. Although blood is a primary transmission route, which increases the infection risk for gay men, MPOX has not historically been prevalent among homosexual groups in Africa, where the disease is most common. MPOX can be transmitted through any close human contact, including sexual contact, as well as through hunting or cooking infected animals, and prolonged direct contact with contaminated fabrics. The stigmatization of MPOX as a disease spread through promiscuous sexual activity among homosexuals can hinder public health efforts. Such stigma can lead to infected individuals hiding their status. The disastrous consequences of linking a disease to homosexuality are well documented, as seen with the higher prevalence of HIV in regions with strong homophobic sentiments. As mentioned earlier, MPOX is an endemic disease in Africa, with thousands of cases reported annually. The first MPOX case in the US was reported in May 2022, and by July 2022, WHO declared the highest level of emergency for MPOX. The global spread of this endemic disease was attributed to the surge in international travel post-COVID-19, with travelers seeking unique local experiences rather than popular tourist destinations. During this period, nearly 100,000 cases emerged simultaneously across dozens of countries. Additionally, like COVID-19, there were asymptomatic carriers, making the situation quite serious at the time. Fortunately, it has now been revealed that the MPOX virus is not contagious during its incubation period. In 2022, the United States promptly distributed the MPOX vaccine, and the Centers for Disease Control and Prevention announced that receiving 2 doses of the vaccine could reduce the incidence rate by up to 69%. Additionally, the MPOX virus is a DNA virus, unlike the RNA-based coronavirus. This means it undergoes fewer mutations, making the vaccine significantly more effective. Also, the smallpox vaccine was found to help prevent MPOX and alleviate symptoms. Currently, the antiviral drug TPOX, tecovirimat, for MPOX and smallpox, developed by SIGA Technologies and approved by the FDA in 2018, is an oral medication, making it very convenient to take, and clinical results have shown it has a very low rate of side effects and very mild symptoms when they do occur, significantly improving the condition of infected patients. These measures have led to the conclusion of the MPOX outbreak in 2023, with 140 fatalities reported across 111 countries during the emergency period. However, recently, MPOX has caused concern as it has spread, with 15,600 confirmed cases and 537 deaths centered in the Democratic Republic of Congo. On August 14, 2024, WHO declared another emergency for MPOX, 2 years after the last one. Just 1 day after the WHO's emergency declaration, Sweden reported an infection. On August 15th, Swedish health authorities announced that a person who contracted MPOX in Africa was confirmed to be infected after entering Sweden and is currently receiving treatment there. The EU suspects that there may be dozens of unreported cases across Europe following the confirmed case in Sweden. Alarmingly, the strain found in Sweden is the most dangerous type of MPOX virus. The MPOX outbreak in the Western world in 2022 was caused by clade 2, which had a mortality rate of 3.6% in Africa. However, the strain found in Sweden is clade 1b, a variant of clade 1, which had a mortality rate of about 10%. Scientists believe clade 1b might be the most dangerous strain currently in existence, with a fatality rate exceeding 10%. This means that a highly lethal disease is now present in Europe and likely spreading worldwide. Although no MPOX cases have been reported in the US yet, the global movement of infected individuals makes it highly probable that the virus has already spread to various parts of the world. On August 16th, Pakistani health authorities reported 3 MPOX cases, all of whom are currently in isolation and receiving treatment. On the same day, China, recognizing the severity of the situation, issued emergency measures. Starting August 16th, China announced that it would begin monitoring all people and goods entering the country for MPOX for the next 6 months. The initial symptoms of MPOX are very similar to the flu, including fever, headache, muscle aches and fatigue, and may also include lymphadenitis. After about 1 to 5 days, the infection starts to become contagious, and red spots begin to appear on the skin of the hands, face, and soles of the feet. These spots become bumpy and start to swell like pustules. Gradually, they begin to form scabs. At this point, the contagiousness diminishes and recovery begins. In most cases, symptoms resolve within 2 to 4 weeks after infection, but severe cases can lead to pulmonary hemorrhage and death. If you experience any of the above symptoms, please contact health authorities immediately for treatment. Amid signs of a COVID-19 resurgence, a new epidemic has emerged. Fortunately, vaccines and treatments for MPOX have already been developed. Just as the world overcame COVID-19 together, with national and individual preparedness, we can overcome this MPOX crisis as well. That's all for today. Don't forget to subscribe and click the notification bell. Thank you for watching.